Hello everyone, I'm Dr. Disha Kaj. I'm a consultant radiologist and fetal medicine specialist associated with Mom Story. In today's video, I'm going to talk about one of the important scans in your pregnancy, which is called as the NT scan or the first trimester screening scan. Now, when is this scan done? Ideally done around 12 to 13 weeks of your pregnancy. Okay, how is it done? It is done via a trans-abdominal route most of the times, but sometimes to get a clearer picture, we may have to use the transvaginal route as well. Now, what is the main purpose of this NT scan? क्यों करवा रहे हैं? There is a lot of confusion about this. So, why are we doing this? Basically, this scan gives you a risk कि whether your child can have some genetic abnormality or not. So, also along with that, it helps you detect any gross abnormalities with the baby within the first trimester itself. So, we are detecting these things early in pregnancy rather than doing later on in pregnancy. It helps us deal with these things better. What is NT? NT stands for nuchal translucency, which is basically a fluid level which is below the skin at the neck of the baby. Now, to measure this NT, the most important thing is that we want the baby to be in a particular position. The baby is moving inside the uterus. We want it to be lying down in one particular position. Sometimes it might just be difficult for us to get that position, and the doctor may ask, okay, you go walk and come, eat something sweet and come, so that the baby moves and we can get the position. Please do not panic in any of these situations. It is absolutely okay, because we have to measure the NT in that particular position. Along with the measurement of NT, we also see for the nasal bone ossification, that is whether nasal bone is seen or not. Supposing we don't see a nasal bone and we see that this NT thickness is increased, it just gives you an indication that there might be some genetic abnormality which might be there in the baby, or some abnormality, and we should investigate it further. With these scan, your doctor will always prescribe for a blood test, which will be your maternal blood test, mummy ka blood test they will prescribe. Usually, commonly prescribed is the double marker test. So, along with all of this, there will be a combined risk that the doctor will tell you that, okay, now your baby has a higher risk of some genetic abnormality or a lower risk. Now, you will ask me, ma'am, what happens if my baby has a higher risk of genetic abnormality? NT scan is just a screening test. It is not giving you a confirmed diagnosis that your baby has Down syndrome. It is just a screening test that, okay, your baby can have a higher risk of it. In that case, what your doctor will prescribe is maybe some advanced blood test like NIPT, or some invasive test like amniocentesis, in which we remove the water around the baby to check for chromosomal abnormalities. Or sometimes, if you are not seeing some part properly in NT scan, the doctor will advise for an early anomaly scan at 16 weeks. So, NT scan gives you an idea that what is to be done next. Next, you will ask me, ma'am, my NT scan is absolutely normal, so I don't have to worry about any abnormality with the child. No. If your NT scan is absolutely normal, despite that, you have to do a detailed anomaly scan at 19 to 20 weeks, because parts are still forming. We are ruling out gross abnormalities in NT scan. The anomaly scan is the detailed scan, and that has to be done even if your NT scan and other markers are normal. Along with all these things that we see in the baby, there is one more important thing that we check in NT scan, which is the mother's blood flow to the uterus, which is the uterine arteries. Now, in case if there is a higher resistance of blood flow at around 12 weeks of pregnancy itself, what will happen is later on the blood flow will not be adequate, and the baby will go into growth restriction, growth retardation. So at an early stage, we are trying to predict that आगे जाके बच्चे को growth restriction होगा क्या. If there is a higher resistance, your gynec will prescribe medicines for you that will alter the blood flow and improve it to the uterus. So overall, when you go to see, for the overall management of the pregnancy, further management, NT scan turns out to be a very important scan, and hence please get it done within the duration of time that your doctor prescribes to you. At Mom Story, we are Fetal Medicine Foundation certified radiologists which follow guidelines for doing this NT scan. So for more information, please visit Mom Story. Thank you.